Hello to everybody. My name is Idrissa Ouedraogo. I am an assistant professor of development economics at Thomas Sankara University. I am also a researcher in corruption, gender, and sustainable development with University of Zongo in Burkina Faso and Dublin City University in Ireland. I'm going to discuss and talk with you about corruption and health in the next 20 to 30 minutes. So, expanding access to healthcare is a key objective of national governments around the world and of international agencies and non-governmental organizations. In this regard, Sustainable Development Goals, particularly Goal 3, and African Union Agenda 2063 have set as main goals to improve access to medicine and medical treatment, and also life expectancy in the world and in Africa, respectively. This is because the availability and accessibility of healthcare is among the important influences of life and death. While progress has been recently made in many countries, life expectancy remains low by international standards, and maternal and infant mortality remains high. While health care or access to medicine and medical treatment or health outcomes are a function of many economic, social, political factors, environmental, trade factors, and also institutional factors, there is a reason to believe that corruption, the abuse of public power for private gains, plays an important role in determining access to healthcare and health outcomes. So, our presentation will focus on 4 points. The first is on the definition and types of corruption in the health sector, and the second point is on the basic ways on how corruption can affect health. And the third point will be on the empirical evidence on corruption and health. And the last section is on how we can control corruption in the health sector to allow people, citizens around the world to get, and particularly in Africa, to get access to healthcare and improve life expectancy. So generally, Transparency International and many researchers around the world define corruption basically as the abuse of public power for private gains, and it can take different forms in the health system, and the most direct and immediate of which is bribery, where a bribe is demanded to provide or to speed up the provision of the health service, in addition to the official payments. Healthcare corruption can take also the form of administrative corruption, embezzlement of medicine and medical devices, improper marketing relations, insurance fraud, and procurement corruption, and state capture. So the different aspects, different type of corruption have been widely discussed by Vaillant in her work in 2028 and Vaillant and Crable 2016. So interested attendees can look at their work and improve their knowledge on different types of corruption, particularly in the medical sector. So there are several basic ways in which health sector corruption affects access to medicine and medical treatment. Corrupt countries usually allocate fewer public resources to the health sector, and corruption also affects the choice of government on how to spend resources allocated to the health sector. Choices that are usually made at the expense of primary healthcare programs, such as immunization and family planning. So in the health sector, corruption could reduce access to quality medical care by inflating the cost of health projects, training resources, and delaying upgrade and essential repair of health infrastructure and equipment. So it can also discourage the use of public health facilities, impose restrictions to the consumption of health services, reduce immunization rates, and delay the vaccination of newborns. So by eroding trust in the public component of the health system, citizens can may not use public health services and resort to auto medications, which can be terribly dangerous for their own health. So yes, and because citizens will lose satisfaction with public health services, they can easily resort to those auto medication and many similar practices. Inadequate supervision by regulatory bodies, laxity, and insufficient controls due to corruption can lead to absenteeism of health workers in public facilities. And this is likely to be widespread in developing countries because this type of corruption, called silent corruption, is also dangerous, where patients may come to the hospital and do not find physician or health personnel around because he or she is somewhere else or is usually late at office. So corruption can lead to the marketing of fake or poor quality medicines on the market and the shortage of medicines available in public facilities due to theft and diversion to private pharmacies, all of which are detrimental to public health. So the health sector is particularly vulnerable to corruption in the drug sector due to the prevalence of information asymmetry issues in the sector, which can create abuses from healthcare personnel who can find themselves in our prescribing some particular medicine to patients in order to receive after some payments. So corruption has also positive aspects, at least for the bribers, such as the creation of a better and continuous relationship between health personnel and patients. So, and following the principal agent theory, financial rewards can also incentivize workers to work harder and smarter and provide better health for services, particularly in the context where salaries are very low. Salary of health worker personnel are very low. So basically, there are two hypotheses on the effect of corruption on the economy. The first one is the sand in the wheels hypothesis. Make it that the sand in the wheel hypothesis, which is which showing that by increasing cost and uncertainty and reducing benefits, corruption can act as a strong disincentives to economic activity. This is what we have mostly highlighted in this talk, in this discussion. But as Via and Prendergast show, it can also have some positive effects. So it can grease the wheels. It can grease the wheels of an economy by allowing people to bypass costly and inefficient regulation and red tape. So, however, civil servants or bureaucrats can intensively create constraints to oblige people to pay in order to get the services, the health services they needed. And also corruption, financial incentives through corruption can motivate workers as well to focus on quantity more than quality, particularly when tasks are very complex. This is because a quantity is easier to measure. So access to medical care might be intentionally reduced by health service providers to induce more payments. So after this section, we'll move to the empirical evidence on the relationship between medical corruption and access to medicine and medical treatment. People, we should know that people who have been victims of misfortunes are more likely to be the targets of bribes in the context of healthcare. Patients or the families who are in urgent need of medical care make for easy targets for corrupt healthcare workers and administrators. So corruption eats people when they are down. Corrupt health officials and health workers may seek bribes in exchange for access to healthcare or to speed up the provision of a particular service. It can affect decision making at a very fundamental level within the medical system. So in Europe, there is strong positive association between corruption and antibiotics use. Corruption also affects the composition of public expenditure. It can adversely affect health sector through reduced funding allocations. In all these ways, corruption can plausibly lead to diminished healthcare capacity and block access for those who need it. Corruption significantly increases mortality rates and reduces life expectancy and immunization rates in developing countries. In Turkey, for example, Dense and Tearman have shown that increases in corruption track with increases in infant mortality in the long run. In Uganda, bribery is associated with worse health care for the briber, thus undermining the goal of increased access to health care. Ortega and the colleagues shows that corruption undermines the growth of the health component of the Human Development Index developed by the United Development Program. So in our own work, we particularly in the corruption, gender and sustainable development goals project, we have investigated and quantified the effects of medical corruption on access to medical care in Africa. Through this work, we contribute to the literature by looking at the effects of corruption on healthcare access other than on specific health outcomes. We use the Afrobarometer's survey data where they ask respondents about their access to medicine and medical treatment. These large-scale representative surveys also allow us to look at specifically corruption in healthcare as opposed to generalized measures of corruption perceptions, as we most often see in the literature. So the data are collected from face-to-face surveys with respondents randomly choosing to ensure a nationally representative sample. Afrobarometers uses a national probability sample designed to generate a sample that is a representative of all adult citizens. The goal is to give every adult citizens an equal and known opportunity of being selected for an interview. So they achieve this by using random selection methods at every stage of sampling and sampling at all stages with probability proportionate to population size wherever possible to ensure that larger geographic units have a proportionally greater probability of being chosen into the sample. So the Afrobarometers applies this a clustered, a stratified, and multi-state area probability sample such that all citizens of voting age have an equal and known opportunity or selection for an interview. So Afrobarometer surveys data allow us to create regional indicators of the incidence of bribery in the healthcare and ask if the level of medical corruption over and above one's own experience, own or that experience of paying a bribe is important in terms of access to healthcare. We ask whether a corrupt healthcare system has consequences for populations in Africa ability to access care and whether they themselves can or will pay bribes to access care. So the data is made up of 34 countries, and they were collected between 2018 and 2022. So we measure the access to to medicine and medical treatment by the answer to this question. Over the past year, how often, if ever, have you or anyone in your family gone without medical care? The possible answers are never, or just once or twice, several times, many times, and always. On average, 44.46% of respondents have gone several times, many times, or always without medical care in Africa. So in Guinea, Senegal, Angola, Sudan, Zimbabwe, and Cote d'Ivoire, the situation is even worse because more than 54% of respondents have gone several times, many times, or always without medical care. So more than 48.50% of respondents found it difficult or very difficult to get the medical care they needed. Regarding the corruption measure, the question that was asked to the respondent is, how often, if ever, did you have to pay a bribe, give a gift, or do a favor for a health worker or clinic or hospital staff to get the medical care you needed? A respondent can answer never, once or twice, a few times, and often. So we create a dummy variable from this information, which takes a value of 1 if the respondent say that they have at least paid a bribe once, and 0 if they never did so. So 11% of people in our sample have had some experience of bribery in the health sector, in line with previous studies of health access to medicine and medical treatment or outcomes. We control for a range of important confounding factors such as health infrastructure, AIDS, gender, urbanization, education, and poverty. 45% of people in our sample live in urban areas. 50% of respondents are females, with very small variations across the countries. The average age of people in our sample is 37 years. 60.60% of respondents live in an area where the enumerator noted a health clinic within easy walking distance. So we estimate other profit models in which the dependent variable captures access to medicine and medical treatment. This is because employing other profit models allow us to use all the available information in the question on access to medicine and medical treatment. We include country effect to allow for time invariant, cross-country heterogeneity, and cluster for standard errors at the level of the survey area. We report the marginal effect to facilitate the interpretation of the result. So we plotted this figure and on control of medical corruption and access to medicine and medical treatment. And the figure shows that there is a positive relationship between control of medical corruption and access to medicine and medical treatment. For example, a country like Mauritius, Cabo Verde, and Namibia, who have more control of medical corruption, tend to have citizens who have more access to medicine and medical treatment. On the contrary, countries like Liberia, Uganda, Sierra Leone, Guinea, and Angola, who have lower control of medical corruption, tend to have population with who do not have who have low access to medicine and medical treatment. So, um, so further findings show that respondents living in subnational regions in which corruption in the health sector is more common are more likely to report that they they have had to go without medical care for themselves or their family regularly or lack access entirely. So corruption in other aspects of public administration, for example, education, issuing identity documents, and police corruption, is not significantly associated with access to healthcare, suggesting that when it comes to access to uh, um, uh, medicine and medical treatment or improving it, and controlling medical corruption is of primary importance. So the regional incidence of medical corruption predicts more difficulty in terms of obtaining the care that a respondent needed, and for those who have access also medical care. So medical corruption is associated with a lack of access for both men and women. But the estimated marginal effect of women if anything, somewhat smaller. This is probably due to specific government programs for women and children in the health sector in many African countries, and also the intervention of international programs from NGOs and other international development actors. So a well-known example is the implementation in Burkina Faso of free healthcare for women and children under 5 since March 2016. That's pregnant women. So medical corruption not only restricts access to medical care, but also degrades the quality of the service for those able to access the system. So our findings add to the existing literature that has shown how corruption is a serious threat to sustainable development, thus resulting the notion of corruption has grease in the wheels in favor of the sands in the wheels hypothesis. So they add further weight on the case of devoting substantial resources to help sector-specific anti-corruption efforts. Government and non-governmental organizations wish to foster health capital development through access to medical care have common cause with anti-corruption advocates and practitioners. So to sum up, corruption negatively affects the achievement of Sustainable Development Goal 3 and African Union Agenda 2063 in the health sector. So corruption has detrimental effects on access to medicine and medical treatment. So and probably could affect life expectancy at birth in African countries. So corruption is bad for our health. So to curb corruption and foster access to medicine and medical treatment in African countries, 3 types of policies can be promoted or implemented. The first one is that this incentivizing bribery by increasing salaries in countries with low public sector wage inequality could be one of the most effective measures to reduce corruption in the health system. This is because in most African countries, health personnel salaries are low, and this can help. This can get them either to to bribe or to migrate to other countries around the world where they have better living conditions and salaries. So the well-known brain drain of medical personnel in Africa. So yeah, if government increases their salaries and their living conditions, the working conditions, they can reduce bribery and at the same time keep them in their countries. So this is because investing also in health personnel is take times and is costly. So secondly, increasing the expected cost of paying and accepting bribes or increasing the gain of avoiding involvement in bribery would reduce medical corruption and foster access to medical care. This we emphasize here on increasing the cost of bribery. Civil servants or bureaucrats who will find them in bribery, in briberies, could get punished, for example, by uh, by the rules and laws in African countries. So setting up also enforcement of anti-corruption law uh, and enhancing transparency and accountability by joining international initiatives in healthcare reform would also be important in this regard. So, in this regard, the digitalization of the payments of the health service payments in many African countries could help curb corruption in the health sector because the money will be directly paid to the system, but not to a particular person. So, following clear equations to curb corruption, countries should promote accountability, transparency, and also maybe through the educational system and uh, and and broadly in the society, they could promote integrity that can help people disengage themselves from corrupt activities. Enforcing rule of law is also important because when somebody or when a physician or health personnel um, knows that they will be punished by the existing rule, even if they have connections, they can refrain themselves from embezzling or stealing and, resources dedicated to improve our health or in in his country or in their country. So thank you for your attention. We hope you enjoyed our talks and discussion, our course. I wish you also good opportunity for the next section. Thank you. See you next time.